Sanjay Prasad, President and CEO, Mission of Mercy Hospital and Research Center, Kolkata. A huge round of applause for Sir, please. I want mic. Mr. N.K. Ramakrishnan, CIO, Sir Gangaram Hospital, New Delhi. A huge round of applause for Sir, please. Mr. Joy Chakravarti, COO, PD Hinduja Hospital, Mumbai. Dr. Rana Mukherjee, Director, Care Continuum. Huge round of applause for Sir, please. Dr. Indira Behra, Senior Manager, Strategies, Global Health Strategies, Emerging Economics, Private Limited. And Mr. Bhudev Chakravarti had to leave early, so he joined in our past session. So I would request everyone to please come on stage, and rest Mr. Sanjay is handling, so I am off the job now.
I love it when people say that they are off the job right now. Don't say it too often, I'll take up your job now from here on. But thanks a lot, guys. I think I've got an amazing panel over here. Now, if you see the term amazing, we've got 4 persons over here, and sometimes it's extremely important to understand that there is a lot of inclusiveness and diversity. There cannot be a more diverse team than this. Right at the extreme, we have Dr. Rana Mukherjee, a clinician who's based out of quality, accreditation, and technology is a passion which he drives forward with. Beside him is a dear friend of mine, Mr. Niranjan Kumar, and somebody who's passionately based his vocation to merge with technology and has been leading technology from there. And then we have the lady in the group, Dr. Indira Behra, who actually brings in the perspective of complete public health that we have. And then a person needing no introduction in Calcutta, at least, Mr. Joy Chakravarti, who's part of an alumni from the institution over here and is a great contributor to the work in public health and in private health to this part of the city, but is currently based out of Bombay. So 4 persons who bring in a perspective of operations, public health, IT, and the clinical perspectives that we have. I'm confident that we are going to be having a great time of deliberation and conversation. My request is that to make this time more meaningful, one way of doing this is that we can just have a talk over here. People over here will say what they have to, and then it's done and over with. But a more meaningful contribution would be if we who are left behind, and they say that there are 2 things which is terrible. One is a graveyard shift, and the other is a post-lunch session at the conference. I think a challenge would be, I'm confident that at some point of time I see cups and sauces over there, so tea and coffee might be served, might not be, but I'm confident that this team is going to lead the way. I wanted to start off by talking about the vision for the new millennium, and this was done by a respective APG Abdul Kalam ji, and in his book he writes, as a chapter number 3, the evolution of technology, which is a vision for 2020. India's core competencies. We can talk about the world, we can talk about the Martian movie, NASA, Mars, all of that. Today's conversation is going to be subjected to what we know and what we do in a country like India over here. Your country, brother, shall be your love. Your country, brother, shall be your love. Good unto better you shall improve. Great deeds indeed are needed now. Work hard, work long, in farm and factory. Let the land be abundant in milk and honey. Flood the land with goods, all made at home. Spread your handiwork all over the world. Are you a patriot? Do not shout it aloud. Bragging never did anybody any good. Quietly do a fine deed indeed. Let the people see it. It is they that decide. This is by Deshbhakti by Gurajada, translated from Telugu by Sri Sri Mahakavi. A starting conversation from our respected APJ Abdul Kalam. Our topic today is leveraging technology for healthcare transformation. So 2 or 3 premises that we have is that healthcare is already at a state where the basis has been established. How can we now build up on transforming this is going to be the key of our deliberation. Even as we start, may I request all of us over here give a great round of applause for our panelists over here who will be bringing us wisdom today. Just one more thing, they have threatened that if I ask them to come and speak, stand up and speak, they're going to walk out right away. I will not discourage them. We will have a conversation right from this dais over here. Blessings. Now I know that in your hands you've got a schedule over here which talks about how the order of events will be being played out. But I always thought when you have one lady in the group, it's always going to be ladies first. So, and she has given me the permission to go ahead. May I call upon Dr. Indira to actually share her perspective very quickly, and we'll go then around the line to actually share where we stand so that we can get a perspective on public health, transformation, leveraging technology from Dr. Indira. Dr. Indira, please.
Thank you, Sanjay. In this world of equality, I'm glad that we know who still leads the way.
Totally.
Okay, on a more serious note, I think coming from a public health perspective, in particular working very closely with policymakers and a range of public health projects, there is a lot that technology can actually bring to health. But before we go into and jump into how it can be integrated and what it can do to transform health, like I was mentioning earlier, I think it's important to know what we're looking for when we're talking tech. What are the goals that we seek from a good, high-performing health system? We seek the standard. It should be efficient. It should be a responsive health system. You need to have it. You need to make sure it's accessible to everybody. You need to make sure that when the outputs are an increased health level and a certain degree and a great degree of equity in what we do. So if we're talking technology, the aim of that technology shouldn't just be, of course, technology brings, you get more accurate diagnostics. Digital images have taken things far beyond what we had imagined. Digital diagnostics are far more specific, far more accurate. But I think a key element that we kept missing out in, and was brought up earlier today also, was the affordability aspect. And we need to be able to start seeing how do we make technology more affordable and where, or if we need to, then where are the trade-offs between the costs and the benefits? So that's something important to keep in mind. Technology isn't just restricted to, of course, information technology, IT. Today we're talking about things like wearables. We're talking about digital, we're talking about digestible sensors, things that can really change preventive health. They can change the way people's health behaviors are performed. We're talking about, of course, we're talking about, the various types of diagnostics. We're talking about 3D printers. We're actually in an era where people are trying to print organs. They're trying to print tissues. We have fantastic health information systems all around the world. And actually, we're starting to use them in India as well. I'll give you an example. Some of the projects that my organization works with, there's the RNTCP, the Revised National TB Control Program, has an excellent platform, an IT platform running in 3 of its pilot projects, where it's not just about, they have their existing NICSHARE system, which is supposed to be a data collection and surveillance tool. This is even better. We're talking about supply chain management. We're talking about ensuring that private providers and that are integrated in this private sector engagement model, private providers and chemists are actually given their money on time, that people get calls to make sure that they're taking their medicines, that there's a certain, responsive level. There's a customer satisfaction call in there as well. So there's so much that these can do. we don't need to just stop at, saying IT means we can collect data. It can collect data and do so much more. We can use existing, or another thing, we have a school health project where we've actually worked with, and built up the school health part of one of the municipal corporations to make sure that now children in, I think it's 99 schools, there have been 36,000 children that have been screened. Okay, we're looking at 122 indicators. There's actual analysis of the data that's going in. So there's a lot that can actually be done. The point is that what are we aiming to achieve? We shouldn't just be throwing things in because they look fancy. And as we do this, we need to keep in mind certain challenges that are going to come up. There is always the cost factor. There's also going to be a certain level of policy resistance. Okay, so as sitting in this kind of environment with so many people from the private sector, we need to be able to see how we can weigh in, as whatever, civil society, as technical experts, as a private sector, how do you weigh in and work with the government rather than sit on top of them or, stand outside their offices and perform the role of the activist? And I think finally, we need to keep in mind that as these things grow, laws and regulations have to shift accordingly. We will come to an era where people are going to start questioning the use of data, looking at data security, confidentiality, or even in the case of 3D printing, what are the ethics and laws involved in printing, a human heart? So I think as we talk about these things, these are things that we should find out why we're doing this and what can possibly stop us from getting, and going to that next step.
Thank you, Indira. I think it's touched upon, this is just an introductory remark, we've touched upon certain extremely important perspectives and something as simple or as profound as data security. I think while we are getting data from multiple sources and we are trying to do the mix and churn in them, I think at some point there are outlets which are emerging. How can you and I as hospital administrators, as people responsible for patient confidentiality, be able to be that guard, be that guardian, be that doorkeeper, so that this data does not get into the wrong hands? And that's what our challenge is going to be going forward. I'm going to just touch a bit on analysis of this nature, but I'm going to request on Mr. Joy at this time. He's leading one of the premier institutions in the country, the PD Hinduja Group, as Chief Operating Officer. And whenever I've spoken with him, he's brought out live examples of how he and his team have been able to leverage the power of technology into making the life of the patient much better. Now, this is a conversation happening in one of the biggest metros in the country, and we are very keen to actually hear from Mr. Joy at this point of time.
Good afternoon, and I hope all of you are awake. The light is on, and we are in the dais. So, as Mr. Sanjay Prasad has mentioned about some of the examples, as myself and Niranjan, we are going to have a very thin line between our talk because we come from the similar kind of background and we are going to talk about almost the similar things. I'll be sharing some of the examples from other industries, some of the cases, what is happening in international scenario, and some of the cases, what we are doing in our own hospital. In 2008, I remember there was a very popular small video clippings of Vision for Future by Microsoft. And in that Vision for Future, they started showing a lady is jogging in the morning who is known to be a diabetic and how she manages to store her records of the blood sugar, then goes to the hospital, doctor, checks the parameters, it gets entered, the medication and prescriptions are, given to the patient, and then ultimately before she leaves, how she gets the medication. And it was mentioned that in 2012-13, that is going to be the scenario situation and that is the dream for future. But I think we are far, far away from that, what we wanted to conclude or what we wanted to see in 2012. However, there are certain progress what we have made. So when we talk about the technology for healthcare transformation, what are those transformations? She has touched upon some of the clinical record data management part of it. I'm going to talk about a topic which is patient experience, because that is leading, or rather that is driving us, most of the private operators, like mad, that how do you keep yourself competitive in the market, and as well as patients, they value your service better than the others. So what are the things we have done? Some of these are typical IT, and some of the examples what I'm going to talk about is not related to IT, but some technology adaptation. I'll talk about PACS. Now, many of you in this room are thorough what is PACS and what happens. But I can tell you that today, by virtue of having PACS, along with that speech-to-text conversion of the reports, our report turnaround time has been brought down drastically. And we have measured, we have taken Lean Six Sigma tools to see how it can be brought down. And further to that, what we have developed, the system where reports, as soon as released by the consultant, it goes to the patient mailbox, whatever mail ID has been given by them, as well as to the referral doctor. Similar thing is happening in terms of lab reports. In the morning, we had Attune Technology people here. So they are some of the providers. But this kind of technology adaptation has reduced the turnaround time for some of the services. But further to that, what we have seen, a patient, when they come to the hospital, they are required to stand in the queue for their payment for services. We have probably in Bombay, we are the first hospital, I don't know whether anyone is here, who is providing this service. Somebody can pay for their service through online gateway, and they need not to stand in any queue and directly can go and avail the service. So that is another bit of it. Further to that, what we have done, we have come out with this mobile app as well as the clinical records and data management system, by virtue of which patient records are readily available when or wherever they move. In the morning, there was a discussion that if a patient needs to undergo a procedure, they need to make 4 to 5 different visits. We have reduced or cut down that drastically by maintaining those records and adding a very powerful, which is powered by the technology, home healthcare program, and that reduces their visit. As a result of that, healthcare becomes more, I can't say affordable, but because the client base what we support or we treat, it is not affordable for them, but for them it becomes more convenient. Further to that, I want to bring some examples from the other sectors. Many of us might have experienced in a 5-star hotel, like this happened first in Marriott, that if you enter and if you have stayed there before and if they captured your identity there, as soon as you pick up and try to order for a food, they know from your earlier preference and then they pick up and tell, would you like to have the same one what you had in that hotel before? That means what? They have created they have the data, and on the basis of that, they are providing the hospitality to you. Very recently, in October, again I was chairing a session in Bombay, and I had the privilege of having the GM of the Oberoi Hotel, and he was telling me some of the technology application what they have brought in terms of, again, their customer experience is, if a person comes to their hotel for a stay, initially they are asked, how was your journey, whether you are comfortable. And if somebody tells that, yes, I had this issue, it can be as simple as that the bag didn't reach through that, through that conveyor belt. And if he expresses that, then the junior most staff can enter in their system. They have like a small pad, in that they enter, and that gets flashed into more than 200 of their staff who are likely to be the touch points for the guest. And after 1 hour, if he enters in the restaurant manager tells him that, I understand you had issues in terms of getting your baggages, but we have spoken to the airport people and we told to take care. So that is the kind of warmth, that is the kind of hospitality you can provide. Is it happening in our own hospitals? Probably the answer is no. So now the expectation is whether there is a scope, yes, with the help of our data, the kind of information we collect from a patient in terms of their choices, preferences, and most importantly, we should not forget about their clinical data. We need to create this kind of environment and ecosystem with the help of multiple technologies, and that can take us forward.
I think there's a lot of ground which has been covered, and I'm going to touch briefly on case interactions. If you see the way we are moving as a country, you've just heard a perspective from public health, and you've heard a perspective from operations, and I'm going to call upon them again in a few minutes as soon as we've had the panelists give their first introductory thoughts of here. But pause for a moment. Here we are talking about some kind of analytics being built in so that, we can recognize food habits, dietary habits, smoking, non-smoking, etc. A moment for us to pause as administrators and people leading hospitals. When your repeat customers, your repeat patients come across, have we trained our people? This is not technology, this is soft skill. To greet them by name, to welcome them. I mean, at the end of the day, none of us want to be visiting a hospital by choice. It's just a thought. We'll ponder upon this. We'll talk about this in a few moments. But thank you, Mr. Joy, for sharing that. I'm going to talk to the clinician in the team over here at this point of time. He's been wearing multiple hats, and he's been doing a lot of things. Besides being a surgeon, he's actually started off a home care platform. And a home care platform cannot work but with the active intervention and integration of technology. And I'm going to request Dr. Rana to actually share his perspectives on where we stand with this.
Thanks, Sanjay. He's introduced me as a person who wears a lot of hats. I could be speaking from the perspective of somebody who's providing home care, or from somebody who is planning hospitals, or from the perspective of a clinician, but I'm not going to do any of that. Today I'm going to do something that is completely different from the perspectives that have been offered so far. I'm going to speak from wearing the hat of a dreamer. Now, when you're talking about transforming healthcare through technology, one should aspire for things. One should aspire for where we can reach. And I would like to say a few words on how much technology can actually transform healthcare. Now, if we look at healthcare, each of us has a different way of segmenting it. My way of segmenting it would be training, preventive healthcare, access to healthcare, diagnosis, treatment, and finally monitoring. Broadly speaking, I would hope that this classification would encompass various aspects of healthcare that would be transformed. Now, in terms of the technologies that can be used for transformation, one of the first things I mentioned was training, because I think that that's where everything starts for all industries, all platforms. So for training, the technologies that can make a difference is remote learning and simulation. So technology will come in both these ways for training of doctors, healthcare professionals, even technicians, everybody would be benefited by the the introduction of e-training. And I think that is going to make a big difference in the way the healthcare domain gets its workers. Next, I would like to bring in sensors and miniaturization, because when we're talking about information and transmission of information, the information has to start somewhere, and more miniaturization and various different kinds of sensors will be used to make a diagnosis or to even investigate a patient. It sounds very fantastic, but there are going to be miniature robots injected into a patient's bloodstream, which will test and transmit the internal environment. Again, it sounds fantastic, but it's going to be happening sometime, I'm sure about that. Then, once we're talking about sensors and miniaturization, we have created information, and that information needs to be transmitted. Already, in a very primitive way, we are using mobile technology for seamless transmission of information, which is making, as Joy mentioned, cutting down on things like reporting time, because, or response time for a physician, because they are getting access to information about a patient almost real time. So one of the technologies that is going to make a huge difference in the way healthcare is provided is going to be the ability to transmit data very fast. And you're aware, or you may be aware, that there is technology that has already been developed called Li-Fi, which is a much faster, I think 100 times faster way of transmitting data than Wi-Fi. So these kind of things is going to really make a paradigm change in the way information is exchanged. Once the information has been transmitted to the receiver, then comes the issue of analytics, big data and analytics, because we are entering into an age where every action of ours is going to be monitored, and that is going to create a huge amount of data. It would be physically impossible for doctors to monitor each and every bit of the data. So that is where big data analytics comes in, and this will actually give rise to the ability of identifying deviations automatically. You see, as a clinician, I can say that basically all healthcare or all diagnosis is basically pattern recognition. You recognize a pattern which is different from what is supposed to be. So if this pattern recognition can be done automatically by analytics, then it is going to create a completely different way that healthcare is delivered. There are other areas, I'm sure I'm not covering all of them, but I would like to mention two others that's going to make a huge transformation. One is targeted pharmaceuticals. Now, targeted in more ways than one. Targeted towards the exact organ, tissue, cell that is causing a problem. So that is one way of targeting. The other way is to be able to customize medicine in terms of targeting a group of people who would respond to a therapy better. So that is another way of targeting pharmaceuticals. And finally, I think one of the things that's going to make possibly the biggest change, biggest transformation, is the advance in genetics. Because with the advancement in genetics, you could actually predict which subgroup of the population would be prone to some kind of ailment and take preventive measures even before the ailment has started. And this is going to create a huge change, again, in the way healthcare is being provided. Now, when we are talking about the transformations that are going to happen, I mentioned about the technologies. The transformations I would like to focus on is on the fact that healthcare now is still to do with going to a doctor, having an assessment, then being advised some tests, getting the tests done, get seen by the doctor again, and then a decision is made and the treatment starts. More and more, patients, it's already started amongst the health conscious, where a continuous data is kept about their activities and their body's response to it. That is going to be more and more prevalent. So the healthcare does not start with the visit to a doctor. it starts with the acceptance of monitoring on a regular basis. Now, once that does happen, then the diagnosis is going to be very early, both because of the genetics as well as because of rigorous monitoring. The diagnosis is going to happen much earlier than it happens now. So the treatment is going to be changed because you will not be seeing a disease at a much later stage where a different kind of treatment is required. You're going to see it much earlier. A very good example is that we used to have a lot of stomach perforations because of acidity. They've disappeared. When I was a medical student, one of the commonest surgeries that we performed when we started as an intern, or when we started to do some big surgeries, was repair of a perforated duodenum. You hardly come across them nowadays. And that was because of the introduction of a drug called protein pump inhibitors, the omeprazoles and pantoprazole. Now, because of that, the medicine is preventing the development of the disease. So the treatment is starting much earlier and is affecting the treatment pattern. So this is a way that things are going to change across the field. Now, when you have early diagnosis, so you have early intervention because you know the disease early, and the modalities of intervention are also going to be different because you are going to catch the disease early and you're going to use different kinds of technology with the miniaturization, with the ability to be non-invasive. So the entire treatment cycle is going to be different. I already mentioned about customization of treatment when I was mentioning genetics, and that will reflect somewhat in some of the other forms of medicine that we know of, say Ayurvedic or homeopathy, where they actually classify human beings. Ayurveda says that, pitta and kapha and Vayu, kapha and pitta. So they are three categories of human beings, and the patient, if he belongs to one category, would respond differently to a stimulus and also to medicines. So we are getting to a point where we actually will be able to classify human beings into the way they're going to respond to medication as well. Now, all this is going to lead to a non-interventional management. It's already started. A number of invasive surgeries are coming down. More and more areas are coming into non-invasive treatment, and that's going to accelerate. And this will result, all these will result in a decentralization of delivery. So, which means the whole treatment pattern is going to change. Fewer people will need to go to a hospital. The hospitals will become smaller in size. They will be more decentralized with the ability to access information easily. You actually don't need to be in Hinduja ICU. You can be in Satara, in a small nursing home, which is connected to Hinduja ICU, who will be providing the treatment. So your traveling to centers of treatment is going to reduce, and the hospitals themselves, the mega hospitals that are in vogue now, are going to come down in size. We'll also see that the incidence of acute cases are going to decrease because of predictive medicine, because of the way that we are going to understand early of how the disease is progressing. And in a way, it's going to phase out doctors. Now, that's a big statement to make coming from a clinician. But what's happening is that with big data and good analytics, ultimately, the doctors took a decision about what was ailing the patient, and then another decision about what is going to make the patient better. Now, the analytics and the algorithms that are being developed and the mega supercomputers that are gradually getting miniaturized will mean that sometime in the future, the ability of the supercomputers or the analytics will be as good or even better than the decision-making by human beings, because they won't be affected by the fact that they had a fight with the wife in the morning, or because that they're feeling hungry, or that they want to catch a movie. So the emotional factors will be taken out of the equation, and the decisions will be much more organized. So at some point in time, the decision-making is going to be taken away, and the doctors, I feel, will become PR professionals. They will be doing the hand-holding, the reassuring, the putting up the human face to healthcare. From being the main dynamics of healthcare, you're going to become the human face to healthcare. And which again brings me back to training, because that's where it all starts. And the training will have to be then focused much, much more on communication rather than decision making. And the ability to give, you see, finally, when as human beings we are unwell, we are vulnerable. We want reassurance. Now, a kiosk or a screen will not be able to provide that. For that, there will still be doctors required to give the healing touch. Now, all this may sound very fantastic, but if you look back, 60 years, maybe 70 years, when the first IBM that took up the size of this room was built, and people said that, you won't be selling more than 2 or 3 of these, ever. And look at this. This is equivalent of the computing power of the IBM then. So you think of an MRI, you'll have an MRI this big soon. You think of the most complex medical equipment, it'll be this size soon. And if there are any Star Trek fans here, those famous tricorders that they had, that they just touched and got a diagnosis, those will be true as well. That's my dream.
Thank you. That's been a very, very bold exhortation for a clinician to stand up in a gathering like this and say that, at some point of time, doctors are going to get obsolete. I don't think so that's going to be true, but what he's trying to actually say is that in a country of 1.25 billion people, you're having one Indian born every 29 seconds. We can't reproduce that many doctors. So at some point, your graphs are going to go southward. But here's an amazing truth which has come out, is that if we can't reproduce or produce that many doctors, how can we become the interface? And that's exactly where we're headed. He spoke about IBM Watson. I mean, today the IBM Watson is here. And as a group, we've clearly emerged from, an evidence-based medicine practice to an information-based practice to an intelligence-based practice, and now it's all about predictive-based practice, which we want to get into. All of this, which has been surmised, needs a huge amount of infrastructure. And she said something really amazing. We have 2 choices in front of us. Are we going to be that activist outside the government's office and say that, we are really going to bang on the door till something happens? Or are we going to be the transformational agents of change? Long time back, when I was in high school, I read a poem by Sri Harivansh Rai Bachchan, where he said, "Nar hona nirash karo man ko. इस जग में रहकर कुछ काम करो, कुछ काम करो, कुछ काम करो, इस जग में रहकर कुछ काम करो." It's only when you and I leave the despondency aside and we begin to focus on the hand, will we have more dreamers like this. Because think of all the smartphones which is there in your hand and you're getting updated. Somebody dreamt it, and today we are living that reality. So where there is no vision, the people perish. In the aftermath of all of this conversation, is there anything left to be said on IT and transformation? And Mr. Niranjan has been a dear friend. I spent close to 3 hours after the conference just chatting with him on IT in Singapore 3 years ago. And I'm really confident that as a friend, he will share with us the beauty of what IT is meant to do in your life and my life and how it can become better. Niranjan.
Thank you, Sanjay. Thank you, Priyanka and the team, for bringing me here and for the award as well. When I really talk about the transformation, some of them asked also, are you too much about socialism and things like that? End of the day, the value of whatever we are trying to do in terms of technology should reflect somewhere. There are two, three ways it can reflect. One is, the patient experience, which we all talk about. Like, really between last year and this year, if I had implemented a lot of things in our hospital, are the patient really seeing some, difference in the way they're getting treated, the typical experience part of it. If I can really deliver something there, then I've done real transformation. Second, most important thing is, if I really forget about reducing the cost for the patient, at least if I didn't increase my cost between last year and this year, I've done a great help to my patients. Because every year we keep adding our cost, whatever the procedures we do. If technology can really keep the cost as it is in the hospital, still you're doing a great service to the patient. Third most important thing is between the demand and supply issues. You have like less doctors and more patients and more services, recommends, etc. If you can really keep the patient like quickly get discharged, you don't make them to wait longer in the OPD areas. Small things, but it really creates a big difference. My understanding on the technology or my approach towards the technology is that should be a proper implementation and there should be a real meaningful use out of the technology. A very simple example, like just this morning I really happened to discuss with a group of people putting together a WhatsApp group called Chennai Angels. We all are trying to support the flood victims. Within 48 hours, the Sahana platform, which was used in Kashmir, was configured, and today all the thousands of NGOs are trying to really deliver a lot of services. In fact, one of the forward keeps coming saying that in Chennai, more number of volunteers than the victims. So but how is this really going to get delivered to the people there? So they really thought there should be a registry of the victims. So how do we really get the registry? Within 2 hours, through the WhatsApp group, they finalized that Sahana platform is really good. It's open source. It's proven in Kashmir. It's proven in other countries. Within 4 hours, someone said, I will host it. Someone says, I will configure it. And today morning when I got up, platform is up and running. Already 250 NGOs or their services are already online. I think this is the real transformation. And we don't really, as rightly said, we didn't really wait for the government to do that. We didn't ask for any NIC to come into picture. And no fund was collected, it just happened. So it's kind of a crowdsourcing, they're trying to do it. So similarly, if we can really contribute at our own hospital, we need not to think wide, a big thing. If every one of us can really contribute to our own organization, the patients are coming to our own hospital, that's more than enough. 2, 3 small things I'll tell you which really changed, are going to change the way patient experience, especially hospitals like ours. I think most of us, representing charitable hospitals where we cannot really, go and demand a huge budget like Manipal and other hospitals for implementing IT. So we have to really think of a solution where I cannot ask huge money, but I have to prove the value of delivery or value of the investment before I can go and ask for a big budget. Within 2 or 3 months, I'll be really happy to really invite all of you to come to Gangaram Hospital, where we would have really gone live on the concept of smart OPD. 3 days back, I presented that in Hinduja Hospital, where each and every patient is going to be given a digital case sheet, means they're going to have that OPD case sheet in their mobile. All the doctors are going to really have each and every kind of interaction with the patient, either as a video or as a picture or as a proper kind of a digital format in their tab. And most important thing is a simple functionality we introduced, and I was really happy to see some of the doctors really got up and said, it's the best experience. We took the picture of the patient through iPad, through the app of the patient wherever there is an injury, and then on the top of the picture, the doctors was writing, see, this is where the wound is, and this is what I'm going to do it, and that become part of the report. Dr. Sanarajan, it's a great idea, because it clearly tells the patient, this was the problem, and I'm trying to really solve it. And next time when the patient comes, maybe some of the dermatologists, I think they used to do it, but in this case, we started doing in OPD. It's a completely OPD automation. It's a concept, it's a very unique concept. We are not going to charge even 1 rupee extra from the patient. Doctors are not going to pay. Hospital is not going to pay. It's going to be a self-sustaining business model. But each and every patient OPD records are going to be on their mobile as well as on the cloud. Second thing is today morning, for which they give me the award, was a cloud-based spend management platform. the important reason I'm trying to do it little non-clinical aspect of it, but you should really focus on that is straight away you can think of 10 to 15% of your margin you can really achieve in that. That means you can give the benefit to the patients, or at least you can keep your profit enough so that you can really enhance your hospital. Every medicine you buy or every equipment you buy or every IT system going to invest, there's going to be a huge margin there if you really properly negotiate, if you know exactly where to buy and what to buy. We all are very busy. Most of the operating officers or executive officers or CXOs, they're too busy doing too many things. They can't get into each and every negotiation. They are given a piece of paper with multiple comparative items. They have to take a decision, L1, L2, L3. But if you really use an intelligent platform, it's going to really give you huge kind of margin there. You're going to get the right product. That particular platform that basically personally I developed it, it's completely open source platform. And in our pharmacy e-procurement, minimum it would have increased like 15% of margin I'm talking about 150 to 200 crores of medicine purchase. So please use the technology, but ensure that it really delivers something in real time. It gives the experience to the patient, or it should, without increasing the cost to the patient, you are able to really give the benefit to the hospital. If this is done, I think we are really talking about transformation. Thank you.
Thank you, Naranjan. That's been very crisp, and I think there's a lot of ground which has been covered today. If there's anybody from the administration of the event, how are we doing with time? How much time do we have? 5 more minutes. Excellent. I've requested Dr. Indira, they say the proof of the pudding is in its eating. And I think at the end of the day, you heard some extremely elucidated conversations on how we can bridge the gap and transform things. But like they say, the proof of the pudding is in its eating. I have requested her to share very briefly a case study which she has done, which will elucidate all that we have shared.
Thank you, Sanjay. I think, there are so many things that can be brought up. Maybe just one is the model that I had touched upon earlier, which is being essentially run by the RNTCP. So it's government run, the state RNTCPs of Maharashtra, Bihar, and Gujarat. As part of this private sector engagement model where, now we all know that almost 80% of the population goes to the private sector as their first point of care. That's an established fact. Rather than denying that fact, the government has decided to say, okay, we'll create a network of doctors and chemists, and basically the way it works is that you can go to the private sector, these network doctors and chemists, and get the same treatment. Where does technology come in? Very simply, a patient goes to the private doctor, may have, display signs of TB. Doctor says, okay, go get yourself, the basic TB tests. Okay, and here you go, there's a little registration number. TB patient goes, get the test done, TB positive, goes back to private doctor and says, okay, I'm TB positive. The doctor then takes this number and says, I'm going to call a call center. Okay, you get registered in the system, all right? Take this e-voucher, go get yourself a free x-ray at one of our networked things. This is done, subsidized, taken care of. Okay? The patient then takes this and says, okay, the doctor says, go to the network chemist. Patient takes number, okay, call center number, goes to the network chemist, gives it to the network chemist. All they do is dial it into the call center, and that's it. Their details are now in the cloud, in the system. They get the free medicines. As part of it, okay, let's say I am a high-risk patient who is probably going to, drop off my treatment for whatever reason, based on the metrics in there. I will get reminder calls 3 times a week to make sure that I'm taking my medicines. I will also get feedback calls to say, is this actually working? And as a result of this, case notification was a huge problem. Okay, it continues to be a big problem in TB. But just with these 3 centers, in just about a year, I think there have been 37,000 or 38,000 notifications. There have been, I'm not sure, a couple of thousand doctors who have actually been networked into this. And as a result, you're picking up on TB a lot better at these. And this is just 3 places, and this is just one kind of model. So this is just one idea of how it's being done in an easy fashion. And of course, there are expenses, but you have to figure out how to move around it. And there is always the concept of economies of scale. And if they want to do more of this, using the same systems and the same setup, maybe cost per unit patient would probably decrease.
Thank you, Dr. Indira. I think I had heard her share this, and I really thought that this would be an appropriate platform for her to share this again. Now, I know that, our time's up, and I think this is a great panel discussion where each one of the speakers have stuck to their brief, stuck to the time, and we are kind of like closing the time, something which is a rarity in conferences like this. But here's the challenge that we have. You can't not talk to the people over here. I know there'll be an outside conversation which will happen, and we can take things offline, but is there any one or two very quick questions which you want to ask anybody in the panel? If there is, please raise your hand. There is Aishwarya Rai, Madhuri Dikshit from Devdas was sitting right here. I saw them and I saw Dola Rave is going to happen over here. But if there's anybody, the mic will go to you, and please, if there's anything, otherwise we'll have to close the shop for the next session. I tell you. So let me end on a note of hope and optimism, because a lot of us who are in healthcare, day in and day out, we do realize that sometimes things are not happening, or sometimes things are not happening as fast as we can. Now, I personally do interact with all of them, and I know the great work which is already happening, but there are pockets of isolation which is happening. He set such a nice example of what was dreamt 60 years ago is now got the capability in his palm right now. So that's how the way the world is changing. And, in the words of Kavi Ravindranath Thakur, he said, "To dakshune kyo na ashle ekla cholore." Be the change, be the person who will make that change. Blessings, guys. Take care, and thank you for your patience on this post-lunch session. Blessings.
Amazing, sir. Thank you for being such an amazing moderator, and thank you for sharing where we were, where we are right now, and where we are heading in terms of the healthcare technology. Now, I would request Mr. Sanjay to please give away a token of thank you to all our panelists. So first, Mr. N.K. Ramakrishnan. A huge round of applause, please. Mr. Anke. To Mr. Joy Chakravarti. To Dr. Rana Mukherjee. To Dr. Indira. And I would request Mr. Joy Chakravarti to give it the token of thank you to our amazing moderator for the day, Mr. Sanjay Prasad. Please come in front for a group photograph. Meanwhile, we would like to thank our partners and supporters for the conference. Our associate partner, Trivector Biomed LLP, they are our associate partner. They are both at the back. Please visit them. And Webel, thank you for supporting us. And Association of Hospitals of East India, thank you so much for supporting us.